So, I want to introduce you to my young friend here, Dr. Aidan Hogan. And when Aidan speaks English, you hear the Irish in him, but he is German and Irish. And I met Aidan not too long ago. He's still in the process. He's in my current group of students right now. He's a surgeon in the BG clinic in Heidelberg. And there's just something really special about this guy when you hear him talk and you hear what's inside of him. I never know how to quantify this. So when I ask him to speak, because he's like, well, I'm not, he's very that Irish humbleness with the Germanness. He's very humble. So I know you're not going to brag about you and what you've done so far. He has his amazing wife with him here this weekend. And what I wanted you to share is the pathway that led you up to becoming a surgeon and your experience now, because you're the primary healthcare provider for your family. And I want you to share that talk we had about what I'm always asking surgeons. You know what I mean? How many people, if you got in a trauma, would you trust to work in your family? How many people would you just trust in the same community to clear out subluxations out of your system? So that's what I would like you to share, okay? Thank you.
Thank you very much, Mark. Thank you very much to you all for having me. It's a great honor to speak here. My story started when I was about 5 years old. I can't remember it myself, but my mother told me that I said to her one day, I want to be a doctor. I'm not quite sure if I knew back then what it was. And five? Yeah, and it has never changed, never. And ever since then, even when I started out at medical school, I was asked, so why did you study medicine? And the most obvious answer is, well, to help people. But that was never sufficient for me, because I always thought, well, I can help people as a social worker. There are lots of different ways to help people. Was it a specific interest in biology and anatomy? No, it wasn't. It was, I would say, was more intuitive. And intuition for me is knowing what without knowing why. And I was very fortunate, I can't say that it's down to my own merit, that I listened to my intuition. So I always have a sort of a voice in the back of my head saying either yes, 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 or no, no, no. Regardless of the surroundings, and it was always yes, yes, yes to medicine without knowing why. So I got into medicine thinking that I'd be a general practitioner. But during the course of my studies, I noticed that I'd only done surgical rotations. And I asked myself why, without knowing an answer, but it just was always this yes, yes, yes. And I assume it just seemed, I'm not going to say honest, it just seemed most pragmatic. And when I was at, so I managed to get a job at this level 1 trauma center near Heidelberg, and worked my way up through the ranks, and I was medevac an emergency doctor on the helicopter. So I go out to major trauma scenes, and I saved people's lives, which was nice. Then on another day, I'd be the trauma surgeon in the trauma room. So I'd admit the patients and I'd perform surgery. That was nice. And we have a rehabilitation center at our hospital. And so I could see the people from where we picked them up on the motorway, for instance, after a motorcycle accident, all the way to rehabilitation. But then I'd come home and my wife would say, I have severe neck pain. And I felt useless. Because if I didn't have all the instruments, if I didn't have my team, I felt I couldn't do anything. So what I would say is take a tablet and go to a physiotherapist. So I said, I'm missing something here. I just feel really, really useless. I couldn't, no. And then another part, which I realized much later, is my wife realized I didn't realize, and you've mentioned it, men are we forget about ourselves. And I was killing myself. So I was working 100 hours a week. I'd work from morning to evening on the helicopter. The next day I'd be 24 hours in the hospital. And I had high blood pressure. And I'll get to my first chiropractic experience with that. So, and what did I do? I self-medicated myself. And that was fine. My blood pressure was fine. So symptom was gone. And I had two profound experiences. I'll get to that in a second. I just noticed in the course of the treatment at our hospital, and I work at a very good hospital. I'm very proud that I'm allowed work there, and I have received such good training. But I always felt once everything is said and done from a surgical point of view, I have no answer for the patients. Now, one person can come up to me and say, I have pain here, there, and everywhere, and he might be a bit mad. And then a second person it might apply to as well. But not everybody can be mad. So if everybody isn't mad, if everybody is telling the truth, then I must be missing something. So I applied to be allowed build up a lab at my hospital for motion analysis. So we have a 3D motion tracking system at our hospital. I have a sports scientist and a physiotherapist, and we do motion analysis on people, especially amputees after trauma. And I noticed that this is fine, it's lovely, I can see what's wrong, but I can't solve the problem. So I have no tools for that. And I looked up, okay, so what non-surgical methods do we have at our hospital to treat these people, bar physiotherapists and occupational therapists? And my job in that would be sitting at a table, sitting at a desk, talking to people and writing notes, but I wouldn't actually be treating anybody. So I looked up on the internet and I found this community called ANOA, and basically it's about a non-surgical approach in orthopedics, and it has three different aspects to it. It has psychotherapists, it has pain therapists, and it has orthopedists. But we have psychologists, 10 psychologists at our hospital. We have a department for pain therapy, but we were, again, useless, not doing anything, sitting at desks. So I applied to my boss and said, listen, if I come up with an idea, would you send me to a course? And that's when I used Google again and found Christian Ster at a similar hospital in Hamburg here. And I saw American Chiropractic. Read it, it looked interesting, a bit different to what I was used to. And I wondered, like, what's American Chiropractic? What's this American thing about? Like, I know Irish pubs in Ireland are called, they're just called pubs. Yeah, and in Germany it's an Irish pub, so there must be just like chiropractic, and what is this? So I managed to call him, and we spoke, and on the other side of the line I had this young man. He was so excited, and I was almost depressed on the other line. On the other side, no, I wasn't, not because he was happy. I just noticed how unsatisfied I was. But I was very happy that I found somebody where he opened a door and I was just looking through. I didn't know if I'd walk through this door, but I listened to him and I asked him what the difference was. And I got the impression, I didn't get a satisfactory answer. I got the impression he didn't know what I was talking about. I got the impression he couldn't relate to what I was asking because something had changed, I suppose, now in retrospect. So I said, listen, where can I learn this? And he said, well, you can go to a few places, but there's only one I can recommend. And that was you. So I adapted my business plan, and I was fortunate enough to be introduced to my CEO, and I was allowed to present my business plan, and he said within 5 minutes, he said, okay, yeah, we'll do it. So my hospital sends me to Hamburg once a month to do chiropractic. Now, the basis of my business plan wasn't just treating patients. I said, first and foremost, I want to treat employees. And I got strange looks initially. And I said, well, the thing is, I put it a bit more dramatically than I did. I said, we're killing ourselves here for humanity, or for our patients. But if I'm in a bad state at 3 o'clock in the morning, neck pain, or I reduced it to neck and back pain because I didn't know much better back then. But if I'm in a bad way, how can I perform on a high level? And that doesn't just apply to the surgeon in the theatre, it also applies to the nurse and even to the cleaning lady. Because the cleaning lady in a hospital is the one who has more contact with patients and more patients than I do. Yeah? My patients are asleep, and the cleaning lady is in the room. When they wake up. Yeah, when they wake up and chatting. Yeah, they talk to the patients. And so if we have cleaning ladies or personnel, also men, obviously, who are healthy, this just gives a different impression of the hospital and just sends a message, a non-verbal message to the patient as well. And so you have to take care of your own. And on my way to work one day, I said to myself, and that was very life-changing for me, I said, what would you do if you arrived here one morning and the hospital wasn't there anymore? Or less spectacular, what would you do if you walked in and your boss fired you? I'd be sad, I'd go home, and I'd find another job. What would I do if I came home from work and my family wasn't there anymore? I'd have a severe problem that I'm not sure how long it would take me to recover from this, or if I would ever recover from it. And that's when I changed my attitude. And this was all in the course of this year. My most profound chiropractic experience was with Mark. It had nothing to do with being adjusted. It had something to do with an on-the-side question quietly. I said, listen, I've been taking blood pressure tablets for quite some time. And Mark stood up and said, hey, listen, everybody. So I remember standing there saying, I'm never going to ask this guy a question again. Trying to maintain my composure and just say, you get through this. You get through this. But I never forget, I say, thinking, he's not wrong about anything. But I'm still letting go. Can you imagine somebody telling you to let go of the ledge of something and just trust him? That was very, very difficult. You weren't that, well, we didn't talk about it then after that. I never spoke to you about it after that. But on my way home, I took the train home.
What did I say? I don't remember.
I don't remember it in detail, but basically you said, it's your choice if you want to kill yourself. You're treating symptoms and not the cause. Just to put it in a nutshell. And it was right. You were correct. So on the way home, I took out my mobile phone and started Googling, food against high blood pressure. And then I said, but that's still treating symptoms. So what could be the problem? And I managed then, to make a long story short, I didn't tell my wife that I quit the blood pressure tablets, but what I did manage to do is I managed to convince my boss that I shouldn't work on weekends and nights anymore. And that is due to a few career steps I had taken at the hospital with the non-surgical orthopedics. I said, well, if you want a top-level surgeon performing surgery at night, you want him performing surgery during the day too. And that's not what I will be doing long-term, so it doesn't make sense. The second thing is, to get away from the weekends, I said, well, if I go to Hamburg, I'm there Friday, Saturday, Sunday. That's like working 3 days on weekends. So, and I still have a family to take care of. And if I work on weekends, 1 or 2 extra, then I'm gone most of the time. So he gave in to that. So since the beginning of the year, I don't have to work on weekends. Since March, I don't have to work at nights. My blood pressure is normal. I am extremely happy. I can be the dad I want to be. I can be the husband I want to be. My marriage has improved. And I am extremely thankful for you saying that to me. It was not easy pill to take. Oh, that's maybe the wrong analogy. But
we understand metaphors.
Yeah.
And that sounds good with the Irish accent. Yeah. So can you just add in 4-leaf clover? No.
4-leaf. Yeah. No, that's just well. So my vision, maybe, if I may wrap it up with this, is I have two visions now. One is I want to take care of the employees at our hospital, and I think the most important thing is to be able to do that on a high level. You have to take care of the people first who are most relevant in decision making, to get the means to do it. So I have started that, and it's working out quite well. I'm very pleased. The second thing is, I have to be a bit careful about this, but I teach medical students at the University of Heidelberg in trauma surgery. So I'm going to, I think I cannot but integrate what I have learned through chiropractic into my teaching. So it's nothing that's separate anymore. I can't just teach orthopedics and trauma anymore without chiropractic. Yeah. So I'm grateful, extremely grateful for that. Thank you very much.